Nurses make up the largest single group of healthcare providers in any country, including South Africa. Professional nurses provide comprehensive nursing services in primary, secondary, and tertiary healthcare. But there is one distinct difference between professional nurses working in primary healthcare and those working in other sectors. Professional nurses working in primary healthcare are called clinical nurse practitioners, and they are allowed, apart from the regular nursing duties, to do clinical assessments, diagnose patients, provide treatment care, and prescribe and dispense medication. Clinical nurse practitioners are at the forefront of primary healthcare, providing nursing services at clinics across the country. Their main duties include delivering nursing care, keeping records, and managing stock. When patients arrive at the clinic, they take their vital signs and observe them to make a nursing diagnosis. For example, they may take their temperature, examine their throat and ears, and test their blood sugar level. After they have examined and observed the patient, they may decide to take laboratory samples such as blood and urine. This may be necessary before they can confirm a diagnosis or prescribe any treatment. Clinical nurse practitioners record the outcome of their examinations, observations, and tests according to prescribed standards. They further provide the required nursing interventions according to the scope of practice. Clinical nurse practitioners do not only see chronic patients, they also handle emergency patients at clinics. This may require using intravenous therapy according to the scope of practice. They may also prescribe, administer, and monitor oxygen and inhalant therapy. A big part of their work is maternal health services, including antenatal and postnatal care. They often have to do an emergency delivery for a client who is in labor. HIV counseling and testing is a regular activity at the clinic. Clinical nurse practitioners are highly competent using specialized equipment such as electrocardiographs and defibrillators. They have the clinical and technical skills to interpret complex diagnostic outcomes and perform emergency procedures. They are very alert and can quickly detect communicable diseases as well as respond to and treat disease outbreaks. This is always done according to protocols and scope of practice. They also participate in mass health and awareness campaigns. Clinical nurse practitioners are responsible for managing the stock and drug supply within the consulting rooms and of the health facilities. As patient or customer service is the focus of their work, it is important that they establish a compassionate environment to support patients, relatives, and friends. If you are interested in physiology and like to take care of people, you may find the nursing field interesting. Clinical nurse practitioners work long hours on their feet, which requires physical stamina and good health. It is important to be able to work under pressure, be practical, and able to make quick decisions. They find it rewarding to know that they provide quality nursing services by adhering to the Batopele principles. These principles refer to ethical conduct and good customer care relations.